small step from private healthcare to a kind of collectivized, nationalized healthcare system. We aren't there yet, but I think this policy does more to push us down that path than any other policy that we've seen dealing with healthcare up to this point. Now, that may be appealing to some of you. Others of you, it may not be appealing. Okay, so whether that's good or bad is not for me to say, but I'm trying to suggest to you that that's the direction that this policy, I think, will be, based upon just kind of neutral or sound economic analysis and the experience that we've seen in other states. Okay, so I'll leave you with those conclusions and also some sources that I have used to kind of form my view of this. Other economists and the healthcare bill itself you can find online. These are also available. These sources are available on this set of slides if you request it, if you'd be interested in it. Okay. Now, I don't know, Jack, do you want to take Q&A now?
Sure.
You want to do that now? Okay. And then I'll turn over to the next presenter. I don't know if I'm meeting my time. I think I'm probably over my time limits here. Yes?
Where does that $50 million number come from? Is that from our government too?
Yes, that's from the Census Bureau, exactly.
Still accurately counts things?
Perhaps. It's not for me to say one way or the other. I'm just reporting the numbers. But yes, that does come from the Census Bureau.
Is that in any way impacting what happens in Mexico?
Yeah, I think that comes from the annual count of uninsured from a survey that the Census Bureau does, and it's not likely to include illegal aliens. I do not believe, because they probably are not likely to respond to the survey. Yes?
If I understand correctly, some of the same groups that pushed for Obamacare, that were behind it completely and lobbied for it, are exempt from it. Is that correct?
Give me a for example or for instance, and then I might be able to comment.
Some of the unions.
Yeah, because that is true. I saw an article recently in Wall Street Journal relative to that. They are wanting to keep what they already have, largely because one of the aspects of this that I didn't mention is that one of the ways in which this policy attempts to pay for itself, because the argument is that it's going to pay for itself, is to tax so-called Cadillac employer-provided health care policies. Well, the unions realize they've got pretty good health care coverage, and their coverages would qualify as a Cadillac plan, and they would be taxed, okay, as a result of this. So they're kind of backing off now, and I think that might be what you're tapping into, or what you're seeing is that they're backing off a little bit and saying, wait a minute, that means that the policies that we have promoted here are now going to make us pay more for the health care plan that we have. We have it pretty good, even what we currently have, so we may not want to support this. Good point. Other questions? Got me more, yes?
I'm a nurse, and I work, of course, for a small rural healthcare provider in our local area. And when you said what it does not do, and the fact that some providers will benefit from this, when you talk about the fact, if you go backwards, there. We, as healthcare providers, we are already not called rationing, but we are having to pay. We have to play by the rules, or we will be denied payment. Which the way they're doing it is a form of rationing. The second line that you had there on mine, when that's also the capping, that's also happening in the reimbursement from Medicare.
Yes, from Medicare and Medicaid.
We need to talk about that because that's so below cost.
Yeah,
Reimbursement is so
absolutely.
below cost that it's a losing situation. So when they're touting that they're expanding coverage, they're not going to have the providers, or at least the small providers, will no longer be able to.
Right, because what you're doing now is, it's happening everywhere. What you're doing, I think, if I understand you right, and my understanding of the market is, you have to shift the additional costs from your Medicare and Medicaid patients because the government will only reimburse you a certain amount, which doesn't cover your costs. You have to shift those costs. In order to remain in business, remain solvent, you have to shift those costs on the people who are insured. Okay? That drives up their premiums. They don't necessarily make that connection. They're in favor of marginalized people in society having access to health care. They don't make the connection that they are paying for it through higher premiums. They yell at the insurance company for passing on a higher premium. They ask their employer to pay more of that premium to absorb that additional cost, which they don't also realize eats into their wage increases, all right, and eats into the ability of the employer to hire. So all of these things are connected. What you will see, I think, if this policy is actually implemented in full by 2014 and beyond, you will see not only price caps in Medicare and Medicaid, which we already have and you're speaking to, but you will now see that price cap being imposed on these exchanges and being imposed eventually on employers, employer-provided health insurance. Those caps will exist, and the providers will be required to meet those caps. And that's where you get the shortage in healthcare. Fewer people will be willing to go into a market and serve a market when they cannot recover the costs of training and human capital and the investment they've made in becoming doctors and nurses and pharmacists and the like. So all you have to do is look at Europe and Canada and other places that have gone down this road. Some of them slower than us, others of them very quickly. They all have shortages of health care. They all have reduced number of beds available relative to the number of people that are demanding them. So they put people on waiting lists, and it creates even more rationing than we have. We have rationing here, as you're pointing out, and I totally agree. It's just that it's not as bad because we haven't gone quite as far down that path. Yes, question?
Then you add to it the demographics of an aging population, baby boomers, and it further compounds the financial unrealistic nature of what's proposed.
Absolutely, yeah. And I think one of our other speakers is actually going to talk about that, the demographics. That's kind of scary, actually, in terms of what to do. Yes? Potentially, yeah. Now, if you can get small enough, if you can get to where you can reduce the number of employees below 50, it's going to drive down your scale and raise your average costs, but you might be able to survive by avoiding the effects of the policy. So anyone who's employing less than 50 people, you might be able to escape some of the most egregious cost effects of the policy. But in this country, we define small business as any business that employs less than 500 people. So that's a lot of businesses. That's a lot of businesses that are potentially affected in the way that you're suggesting. Yes. Perhaps. Gradually.
Well, they want the price of food. Whatever the market bears.
In terms of the number of people that are mandated to be covered, so 50 is now, and you're saying that it'll be 40, 30, potentially could be. I haven't seen anything to that effect, but that's not to say it's not out there. I said there's so many things going on right now, there's so many things being said, so many policies being proposed, many of them not yet in force, and there's policies that are pushing back for implementation of this until a later date, other policies that are trying to change aspects of it, that introduce it earlier, so very well could be the case. I'm just not aware of it specifically. Yes, sir?
I find it real interesting that they come out and go, hey, we're not going to nail you for pre-existing conditions. But by golly, if you smoke or get old, then we're going to nail you.
Yeah, that's true. I'm not sure quite how to respond. From an economic point of view, I have to admit, I'm in favor of that. I got real quiet real quick. From an economic point of view, people who smoke and people who are older are going to subject the pool of insureds to higher levels of risk. That's the reality. You're going to be more likely, what happens if you purchase a life insurance policy